Hello and good morning. As PFF Summit continues, please remember to visit our exhibit hall this week to meet our sponsors and learn more about their work on behalf of the pulmonary fibrosis community. This morning's session is entitled Exercise, Education, and Social Support. I am Laura Devitt, Director of Programs at the Pulmonary Fibrosis Foundation. Speaking today will be Kim Crilly, Derek Zalesky, and Malcolm Mal Doyle. Kim Crilly is the Supervisor of Diabetes Education at Holy Cross Health in Silver Springs, Maryland. She previously coordinated the Pulmonary Maintenance Program for 8 years, where she implemented evidence-based practices to help participants better manage their health and decrease hospital admissions. She is an advanced practice nurse and exercise physiologist with over 25 years of professional experience. She also instructs basic and advanced cardiac life support classes. Kim has a bachelor's degree in kinesiology, a master's degree in nursing, multiple fitness certifications, and is a certified diabetes care and education specialist. Kim's primary interests are in the area of disease prevention and management. Specifically, her focus is on teaching and encouraging behavior changes that promote a lifestyle of wellness. Derek Zalesky is a physical therapist who is board certified in cardiovascular and pulmonary physical therapy at the Hospital of the University of Pennsylvania, with a focus on evaluating and treating patients pre and post lung transplantation. His research, supported by Good Shepherd Penn Partners and the University of Pennsylvania's lung transplant team, has focused on quantifying frailty and the impact of functional outcomes in the lung transplant population. He has been employed by Good Shepherd Penn Partners since 2013 and has been the lead physical therapist for the lung transplant team since 2015, where his responsibilities include performing pre-transplant functional evaluations, formulating pre-transplant treatment plans, conducting inpatient physical therapy treatments, and leading the outpatient post-transplant physical therapy program. Mal Doyle was diagnosed with idiopathic pulmonary fibrosis in February of 2018. He started the Greater Hartford Pulmonary Fibrosis Support Group in May of 2018 and currently serves as the ambassador for the Pulmonary Fibrosis Foundation. He is actively involved with the West Hartford, Connecticut community and has recruited businesses in the area to participate in Pulmonary Fibrosis Awareness Month. Now let's get our session underway.
Hello, and welcome everyone to this session titled Exercise, Education, and Social Support. My name is Kim Crilly. I'm a registered nurse and exercise physiologist with over 25 years of professional experience. It is my pleasure to be presenting at the Pulmonary Fibrosis Foundation Summit. We are going to be discussing pulmonary rehab and why it decreases breathlessness, hospital admissions, and fatigue. Let's begin with discussing the many benefits of pulmonary rehabilitation. It helps to improve the ability to perform activities of daily living, increases exercise tolerance, helps to relieve dyspnea or difficulty breathing, improves quality of life and overall sense of well-being, decreases isolation, and helps to reduce healthcare utilization. So ultimately, these benefits include improved lung health capacity, breathing efficiency, and improved stamina or endurance, which help to decrease the work of breathing. This in turn reduces breathlessness, fatigue, and hospital admissions by improving overall lung health. The exercise training, disease management education, and socialization provided by pulmonary rehabilitation are critical for long-term management and the prevention of hospitalizations. Use it or lose it. So here's the deal with exercise. The benefits of exercise are not stored. It is necessary to exercise regularly to maintain the benefits gained with pulmonary rehab. And ways to maintain pulmonary health include enrolling in a pulmonary maintenance program, maybe finding a fitness center or a fitness class that's suitable to meet your needs, or finding an online exercise program. So let me briefly discuss the differences between pulmonary maintenance and pulmonary rehab. Pulmonary rehab has a predefined duration, often dictated by insurance, as insurance often covers pulmonary rehab. It's a structured program that offers education and support and monitoring, including heart rate, blood pressure, oxygen saturation, and cardiac telemetry. Pulmonary maintenance, on the other hand, is usually an out-of-pocket expense. It does not have a predefined duration and also includes education, support, and monitoring, but usually does not include cardiac monitoring. But let's think of this. When we think of the cost of maintaining an exercise program compared to the cost of a hospitalization due to pulmonary fibrosis, I think you will agree that the cost effectiveness of a maintenance program of exercise definitely is much cheaper than a hospitalization that can cost anywhere from $5,000 to $35,000 for an average stay of usually 5 days for pulmonary fibrosis. Additionally, there's often a high readmission rate within 90 days with pulmonary fibrosis. So let's look at the exercise guidelines. And there is a prescription for exercise based on research. Exercise needs to be performed at the prescribed frequency and intensity to ensure that the appropriate stimulus is created to get the greatest benefits. And of course, to ensure safety as well. So the recommended frequency for cardiorespiratory exercise or aerobic exercise is 3 to 5 days per week at a moderate to vigorous level of intensity. So on a scale of 0 to 10, 0 meaning no exertion at all, 10 meaning maximal exertion, only have a few seconds left before you have to stop. The recommendation is to be around a 3 to a 6, which equates to feeling that exercise should feel somewhat hard to hard. However, the rating of dyspnea or breathlessness should be low. The time, 20 to 60 minutes each session, and we want to try to accumulate 150 minutes of physical activity each week. The type of exercise should be rhythmical, using large muscle groups. This might include walking, swimming, upper body ergometry, and cycling. And let's look at resistance training recommendations. Although the frequency is not as often as that it is for cardio, it certainly is just as important. So 2 to 3 days is recommended each week for resistance training at a moderate exertion to the point of muscular fatigue. It's recommended to perform 8 to 10 exercises, 10 to 15 repetitions each. Those exercises should target all the major muscle groups from head to toe. Try to use free weights, exercise machines, or even your own body weight. Really think of exercise as medicine. There is a prescription to it, and it needs to be taken regularly as prescribed. Special precautions for exercise. Certainly be sure you have a clearance from your physician prior to engaging in an exercise program. It may be necessary to perform short bouts of exercise sessions, maybe just 10 minutes each, several times a day, depending upon the level of shortness of breath. Of course, monitor oxygen saturation with a pulse oximeter and decrease the intensity of the exercise or even stop if necessary and perform pursed lip breathing. If prescribed, be sure to wear oxygen at the prescribed dose, and avoid holding your breath during resistance exercises, and try to practice coordinated breathing. And a lot of these breathing exercises that are mentioned are often taught in pulmonary rehab. So the pulse oximeter, I'm sure you've seen this before, but this is a very important tool to have available. It measures the blood oxygen saturation and heart rate. A normal range for oxygen saturation is in the mid-90s. However, be sure to check with your physician regarding an appropriate oxygen saturation for yourself. And then an oxygen saturation that drops below 90 is considered hypoxemia, or a low saturation. And a normal resting heart rate for adults is 60 to 100 beats per minute. In terms of the anatomy of the lungs, we have a right lung and a left lung. The right lung has 3 lobes, the left lung has 2 lobes. But I want to particularly draw your attention to these sacs. They look like clusters of grapes that branch off from these bronchioles in the lungs. This is where air exchange takes place. And they're very pliable and stretchable, and they help to store air. But with pulmonary fibrosis, these sacs can become scarred and less flexible, which obviously influence gas exchange and can contribute to shortness of breath. So again, pulmonary rehab and long-term maintenance exercise is vital to trying to maintain lung capacity and strength. So when we look at just the normal breathing, we have inspiration and we have expiration. During inspiration, we breathe in the air, bringing in oxygen. And this requires the muscles, our respiratory muscles, to contract. So these include these intercostal muscles here contract during inspiration. And then the diaphragm at the bottom here, another muscle contracts and it lowers. These actions allow the lungs to expand and fill with air. And then during exhalation, we exhale carbon dioxide or waste products, and the muscles relax. The diaphragm lifts up and the respiratory muscles relax, and then the lungs become smaller in size. So again, strengthening our respiratory muscles, strengthening our postural muscles in our chest, our upper back, our abdomen, learning different breathing techniques are very important for maintaining that ability to help foster gas exchange. And so speaking of gas exchange and oxygen transport, let's look at this slide. Think of the cars as the lungs. Think of the cars as the body. Think of the roads as the lung. And so you can see here, both vehicles have the same amount of oxygen. But it's going to be easier for this sports car to transport the oxygen because it's well maintained, it's in shape, it's strong. But it's going to be harder, and there's going to be more effort involved for the truck to transport the oxygen because it's a little run down and not well maintained. And then think of the roads, again, as the lungs. We want a smooth traveling process for good gas exchange. We want to avoid obstructions. We want to have a clear line of sight. So when we think of exercise, it really is medicine. It helps increase that lung capacity. It keeps those respiratory muscles strong for better transportation of the oxygen and delivery to our cells. And kind of just in summary here, to improve this transportation and gas exchange process, we're going to think about enrolling in pulmonary rehab, then moving on to a maintenance exercise program, good nutrition, and taking medications as prescribed. So what about education? Education provides information about the different tools and strategies and reasons why a comprehensive approach is critical to help decrease breathlessness, fatigue, and hospitalization. Education helps to empower the individual to manage their chronic condition. Topics that are often included in education and pulmonary programs include understanding lung disease, medications, nutrition, exercise, healthy coping, common pulmonary function tests that might be performed, breathing exercises, and oxygen therapy. And then what about resources? Where are we going to find all of this valuable information? Education and support are often part of, again, rehab and maintenance. But there's lots of amazing free online resources such as those found on the Pulmonary Fibrosis Foundation site, the American Lung Association, the COPD Foundation. And there's a fantastic program called the Chronic Disease Self-Management Program. It's a free 6-week program. It's evidence-based and it's developed by Stanford University. It helps to teach techniques to deal with frustration, pain, fatigue, talks about exercise, talks about the appropriate use of medications, talks about how to communicate with family, friends, and healthcare providers, discusses nutrition and decision-making. And then, of course, social support. Dealing with a chronic condition can cause stress for both the individual affected by the condition and the caregiver. Stress can result in a number of emotions such as anger, guilt, frustration, denial, and depression. And of course, this stress can negatively impact the body. So it's important to have social support to share feelings with and discuss management techniques. It's also helpful sometimes to have support groups specific to the person themselves that's dealing with the chronic condition, and have a support group for the caregiver that's also dealing with stress. And so where are these resources for support? Again, with pulmonary maintenance and pulmonary rehab programs, Pulmonary Fibrosis Foundation, the American Lung Association COPD Foundation, National Alliance on Mental Illness, Anxiety and Depression Association of America, therapists, counselors, social workers, and local hospitals often have support groups. Many are virtual. Of course, sometimes just talking with a family member or a friend is helpful. So really, as we think about some additional resources, I wanted to share with you some exercise resources that are also very valuable. They can be found on the National Institute on Aging website. They have both articles on exercise in addition to fantastic videos that may be helpful. So again, that's the National Institute on Exercise. And the Pulmonary Fibrosis Foundation also has a toolkit available for pulmonary rehab as well, with exercises and information. So as we conclude, I want to talk about or just re-emphasize the importance of comprehensive care. Positive outcomes really rely on a comprehensive team that includes clinical assessment, exercise, chronic disease management education, nutrition counseling, and psychosocial support. Thank you for joining me today, and I wish you the best of health and management. I am happy to take any questions at this time that you may have.
Hello, my name is Derek, and I am a physical therapist who works for Good Shepherd at the Hospital of UPenn. I've been a physical therapist for 8 years, specializing in the care of patients with advanced lung disease. Most recently, the last year and two, I've been investigating the use of a telemedicine or virtual-based exercise platform to reach more patients at home and to improve kind of the care and the exercise capability of patients with advanced lung disease in the home setting. So today we will chat about when traditional rehab is not available, are there other options for exercise? So by the end of this presentation, I'm hoping that you will understand that it is feasible to provide treatment for adults with advanced lung disease using home-based mobile health program, that it's safe to administer a home-based mobile health program. You will understand some primary outcomes measures of interest that are needed to inform the design and the implementation of an exercise program. And that will have an understanding of the financial impact of frailty and rehospitalization, specifically in the lung transplant population, a population that I work very, very closely with here at Penn, and how that healthcare cost could be decreased with increasing the participation in a home-based mobile health program. So a traditional pulmonary rehab is performed in person, supervised, and monitored. It's usually administered by respiratory therapists. However, a physical therapist or an exercise physiologist or an exercise tech is often involved. Kind of the standard layout is 2 days a week for 18 weeks, totaling 36 visits. And it incorporates a combination of aerobic reconditioning, either using the treadmill or bicycle, and strength training. Oftentimes includes breathing retraining exercises and disease-specific education. And as you can imagine, all of these topics and modalities that are included in class are ripe to be transitioned to a mobile health platform. Those of you that are involved in pulmonary rehab understand there are many barriers to entry and participation in a pulmonary rehab program. And through my combing of the literature, the most common are transportation or access, the financial barrier, both insurance and patient out-of-pocket cost, a general lack of availability of the pulmonary rehabs, oftentimes associated with larger health systems that are not as prevalent as kind of your general outpatient PT locations. And most recently, the growing wait list to enroll to a pulmonary rehab class. So what are some alternatives? What one first thinks of is a kind of standard home-based exercise program, usually written down on paper with an intermittent follow-up with the exercise team, either a physical therapist, respiratory therapist, or an exercise tech. The preferred method from my experience is a home-based exercise program that uses or leverages the mobile health platform. And this begins with an in-person evaluation, kind of understand the person's kind of aerobic impairments as well as other functional impairments that allows you to create a specific exercise program. During that time, you can provide the equipment that is necessary to continue with the home exercise program, such as TheraBands or small weights. Most importantly, as we progress here, you can orient the patient to the virtual application in conjunction with their pulmonologist, establish safe exercise parameters, and most importantly, establish emergency procedures. The app is not used to relay emergency information, but rather to document the exercise progress. So in my personal experience, I'll walk us through a home-based exercise protocol that was established through UPenn, Good Shepherd's Penn Partners, and UCSF medical centers for patients undergoing lung transplantation who are deemed frail, and we use the common outcome measure of frailty, the short physical performance battery test. Frailty is a novel lung transplant risk factor. As you can imagine, it leads to death and delisting of patients waiting for lung transplantation, as well as pre-transplant frailty is a risk factor for kind of post-transplant mortality. Again, what these schematics show at the top of the screen is that those patients are frail have a significantly higher risk of post-transplant unplanned readmission than those who have a severe lung disease as measured by the lung allocation score. And in the top right-hand side of the screen, those that are frail have a significant risk of death within the first year of lung transplantation. So you can see the more participation in an exercise program improve frailty scores, kind of ultimately improve the chances of a positive 1-year survival and decrease the chance of readmissions. So how we designed our program is we aim to evaluate the impact of the mobile health program. We used ACUBE on subsequent readmissions post-transplantation. Again, multi-center design between Penn and UCSF. And who we included were the patients that were deemed frail at the time of their incident transplant discharge and patients that were already readmitted in the hospital from their index admission. And we enrolled them in as well. The graphs at the top of the screen really highlight UCSF's readmissions and Penn's unplanned readmissions. And without going line by line, you can see that there's significant. Again, significant but common for large academic medical centers that perform lung transplantations. So our intervention through the ACUBE app, these next 5 or 6 slides will just walk you through kind of what the portal looks like. Is first you design a prescription and you select from a menu of exercises. As a prescriber, I review the exercise data during for my in-person evaluation and customize the exercise program to each patient. You can see the diary on the left-hand side of the screen. There's kind of standard exercises that can be chosen from, and you can move them over to the right-hand side of the screen, and that's what the patient will see when they open his or her app. They utilize the ACUBE app, and you can see I can customize the number of repetitions performed for each exercise and incorporate, this is important, the gamification for patient motivation, kind of accountability and adherence. Some of the patient testimonials, they like the positive feedback of that green smiley face, and they like seeing the exercises checked off and the sense of accomplishment as they progressed through the home exercise application. Another positive feedback point here is that you can review the patient's progress and results. Again, patient has a sense of accomplishment, and us as the rehab team and the providers can glean valuable information about the patient's progress. Hopefully they improve, but oftentimes as advanced lung disease progresses, if you use it in the pre-transplant population, you often start to see a decrease in their exercise capacity, and that could be an indication that more in-person follow-up is needed. The provider can log in at any time to view the patient's progress. You can see by week. If they participate in many months, you can extend the timeline out by months, and you can see via some nice bar graphs or line graphs as well about what is working well for the patient. Are they adherent? And they can leave any comments as well for us to review. Like I said here, the patient can give a detail for activities, somewhat hard, how is your motivation today? And we can kind of pick up on trends on how the patient is using and how they are moving through the exercise program. Finally, the app is customizable. In this case, you can move exercises from the diary to the live version that the patient sees, and using the patient's feedback and what they have documented, you can either add increasingly challenging activities, or you can kind of ramp down the intensity and add kind of less challenging activities. Again, all in real time, depending on how the patient is moving through the exercise program. So in our instance, the primary outcome we used was the change in readmission rate from the previous year before using the app to the year after we enrolled the patients in the home-based but rehab application program. Some secondary outcomes we used were improvement in frailty scores in patients using the ACUBE app, the decrease in healthcare expenditures, the change in quality of life, and the documentation of adverse events. So our preliminary outcome data showed that we made a positive impact as measured by the SPPB in those patients that were frail, and we transitioned 60% to not frail. And as you learned from the previous slide, if you can transition from from frail to not frail, you have a better chance post-transplant at 1 year survival and decreased chance in readmissions, thus decreasing healthcare expenditures, improving patient quality of life by keeping them out of the expensive hospital setting. So the clinical impact, or some positive patient testimonials, were some themes were that the patients liked having a schedule that they can have in the palm of their hands, easily accessible through the app, something to do rather than just waiting for the next appointment or worrying about the next pulmonary function test. Another theme was that it just felt good and to keep up with the exercise program. And some positive feedback is that the patient kept wanting to do more as he saw the green check marks to keep coming on their screen, wanted to, had a lot of self accountability and to increase his exercise adherence. So in summary, the home-based exercise program that leverages the mobile health technology is safe, feasible, and effective. It can be customized for all patients with advanced lung disease, not just those pre and post lung transplantation. It's most effective, in my opinion, with an interprofessional approach, beginning with the in-person evaluation and then continuing the care virtually or through the mobile health platform. And it is a low-cost solution that has the potential to significantly reduce healthcare expenditures and increase patient participation in a formal exercise program. To circle back to the original slides, one of the barriers to entry was the wait list, and there is no wait list with the mobile health platform. You can enroll as many patients as you feel comfortable following. So we can increase access to care as well as decrease cost, and that is a significant benefit of the home-based mobile health tech platform. So thank you all for listening to this presentation, and I look forward to a lively discussion. Thank you very much.
Good morning and welcome to today's presentation on support groups. My name is Mal Doyle and I am a support group leader in West Hartford, Connecticut. You know, it wasn't very long ago that all of us were doing our support groups without any kind of hesitation. Things were going along very nicely. Then all of a sudden, boom, COVID-19 hit us and put us in a turmoil. Well, the Pulmonary Fibrosis Foundation came to our rescue at that time, and it trained us on how to do our meetings virtually using Zoom. Now, that was an experience. We were trained, and that was fine. But then we had to train people who were part of our support group on how to click on that link to get on, and how to open up their cameras, how to use the sound, turn things on and off, etc. But now we're faced with another dilemma. Many of us had people from different states join us simply because we couldn't meet live anymore, and they certainly wanted support as well. So what do we do with those people now? Well, we have a chance to meet virtually and a chance to meet in person, hopefully within a very short period. So that means that we have to figure out how we will engage both people in person and also virtually. We don't want to ignore either one of them, but somehow I think we will prevail. You know, people have asked on occasion, is there a blueprint to follow for a support group meeting? And I've talked to several support group leaders across the country, and my answer to that question really is unequivocally no. I mean, I've talked to people and they have speakers at every meeting. I've talked to people who have had speakers at every other meeting. And then there are people who are support group leaders that only have speakers when the group itself wants to discuss a specific topic of some sort. So I think it's really all over the place. However, in every single case, and every person that I've spoken with, they always have time for people in the support group to express whatever is on their minds. So whether you have a speaker for an hour, you will always leave time for people in the support group to talk about what's going on in their own lives thereafter. Now, as a support group leader, don't forget, give yourself a pat on the back because you have many responsibilities. In addition to um, promoting the meeting itself, that starts right from, I guess, when your last meeting ends, you promote the next one. You want to be sure that you have speakers for the meetings. You want to be sure that if somebody calls you and they want to be new to the group, you recognize that person. If they come on to your meeting, you introduce them. And then you ask people who are part of the support group to just give a quick overview of when they were diagnosed and what particular lung disease they may have. So there's a tremendous amount of work to be done by the support group meeting leader. But above all, you are responsible for communication as well. So if you notice that somebody that's been on regularly hasn't come for 3 or 4 meetings, then at that point, give them a call, see how they're doing, make them feel like they're a very important part of the group. The other thing that we want to talk about, and I'm not sure all of you do this, but you are a support group leader, and if you are, you have an agenda. Now, what should be included on an agenda? Well, if you're doing a printed agenda, you might find that you put 20 copies out, and when you go back to pick them all up, you pick up 18. So 2 people took your agenda. Most people really want to know and what's going on in their lives. They want to have a chance to speak. Sure, they will be interested in other people in the group and what's happening to them, but they also want a chance to speak. So don't forget about them. But there are a couple of things you may want to consider having on your own agenda for every single meeting. The first thing is tell people that this is a very safe place to discuss important issues, and whatever is said here stays here. The other thing that you may want to make them aware of is that the Pulmonary Fibrosis Foundation oxygen information line is available to them 5 days a week. And when they call, there will be somebody who actually picks up the phone and can speak to them. Also, there will be some medical issues that are discussed at a meeting down the line somewhere. And be sure to remind people we are not doctors. We're just trying to help one another live better lives every single day. So whenever they hear something medical, before acting on any kind of medical information they hear, discuss it with their pulmonologist and make sure that they get approval from the pulmonologist before enacting on any suggestion that they receive. You know that as a support group leader, there are several things, several qualities that you all have in common. Let me go over some of them. First of all, you have a commitment to the Pulmonary Fibrosis Foundation and also people who are struggling every day with this disease. And that's extremely important. You're also very patient. You're understanding. And above all, you have the ability to persevere so that when things get bad, you will fight with everything that's in you to make them right again. And as a human being, there are going to be times when you will be discouraged. When that should happen to you, if it should happen to you, call somebody that you have a lot of faith in, discuss it with them, or you can call a Pulmonary Fibrosis Foundation. I always say, if you want to fall off the third story, that you can have a very safe place to land at the Pulmonary Fibrosis Foundation. So your landing will be very soft if you have something on your mind and you get discouraged, because there are times when you will not think that you're doing what you should be doing. You may hear, oh, this one's doing that, that one's doing this, and think that you should be doing it, but give yourself a break. I mean, you are doing the best that you possibly can for your group, and every group is different. So let's suppose you've been doing this for a couple of years now. Do you need a succession plan? Well, unless you're a medical professional or a caregiver, chances are you're running the support group and you have the disease. That means that you're not going to be top notch at every single meeting that you run. There may be times when you're tired. There may be times when you're really physically not able to run a meeting. If that should be the case, look around for people in your support group. Chances are you'll find somebody who is certainly capable and willing to help you. Identify that person, get them involved, and other people will also help. You can get people to identify speakers for you, to do sympathy cards, to take attendance. So don't try to do everything yourself. That's a recipe for disaster. But you've worked very hard to get this support group up and running. You don't want it to fall apart in case that you cannot continue any longer. So have a succession plan. You'll be glad that you did. So now let's take a step back a minute and think that you've been just recently diagnosed with idiopathic pulmonary fibrosis. Now you've looked around and you cannot find a support group in your area, but you'd like to start one yourself. Well, how do you go about doing that, and how do you do it effectively? Well, we might suggest a quick way of doing it is to check with your local senior center and also a medical facility in your area, because those are two areas that can get you up and running very quickly. Why? Because they have the resources to do so. They will have perhaps a media list for you to contact. They will have a place for you to hold your meeting, a room, and you can be up and running within a very short, maybe even a month, you can get up and running. So be sure that you contact those two facilities. That's going to get you up and running very quickly. Now, the next thing is, will there be a cost involved in doing this? The answer is yes, there'll be minimal cost when you first begin. Things like ink and paper to maybe promote the event itself if you want to do flyers and deliver them to doctor's offices or pulmonary rehab facilities, things like that, minimal costs. However, the Pulmonary Fibrosis Foundation also has a resource, and it's called the Lee Ann Storch Support Group Grant. For newly support groups, that grant is in the amount of $500. You have to apply for it, and you have to keep expense records. That is, keep your receipts from January through December. Submit them. Now, if you don't spend the entire $500, chances are they may ask for some of that back. So try to spend all of the $500. Very easy to do so. If you have a holiday party at the end of the year for your support group members, that money will be gone. But check with the Pulmonary Fibrosis Foundation, and they'll tell you all about Lee Ann Storch. Remember the word Lee Ann Storch. So remember that Rome wasn't built in a day, okay? It's going to take time for your group to get established. Don't get discouraged if you only get 4 or 5 people at your first meeting, because it will probably evolve from that. And the one thing I really want to leave you with today is don't sell yourself short. Remember that you are the straw that stirs the drink, that brings out the flavor to every heart that you touch about pulmonary fibrosis. Thank you for listening, and have a good afternoon.
Okay, I hope you all enjoyed that presentation this morning. We'll now move into the Q&A portion and have received quite a few questions for our panelists today. So we'll go ahead and get started. I think the first question will be for Kim. The question is, why does my O2 level remain below normal for some time after completing exercise?
Sure, I'll be happy to answer that question. Sometimes with exercise, depending upon the intensity, if it's more vigorous, we have to repay what we call an oxygen debt afterwards. So it can take time to repay that debt depending upon the intensity that you were exercising at, in addition to how that oxygen saturation was doing during exercise. So it may take a little longer to repay that debt if the oxygen saturation was, again, under 90 in that kind of hypo state.
All right, thank you. And then the next question for you as well, where is the chronic disease self-management program offered?
So it's also called Living Well. So if you look it up online, it's called Living Well, and then Chronic Disease Self-Management Program. It's also called CDSMP. It's offered at a lot of local hospitals and recreation centers. However, if you just go on the Stanford University website and look up the Living Well program, chronic disease self-management program, it will give you a listing of classes, but also check your local hospital.
Wonderful, thank you. And then this question, I believe, can be for you, and Derek may want to chime in as well. As a former runner used to pushing it, can I actually do more harm than good by exercising too vigorously?
Derek, do you want me to start, or do you want to start?
Kim, why don't you start?
Sure. So I love this question. I appreciate your hardcore personality and pulmonary maintenance. We have a lot of dedicated individuals that, they're from that mindset and they like to push, and I appreciate that. We just want to do it in a safe kind of conditions. So again, we need to evaluate that oxygen saturation, because if that oxygen saturation is dropping to dangerous levels, you're putting an increased demand on the other organs of your body. So, we don't want to increase our risk for any heart event or any stroke event. So we need to push within reason, monitor our intensity and monitor that oxygen saturation, and where oxygen when prescribed and at the correct dose.
I would add that if you are truly the vigorous runner, that our clinic offers an exercise stress test where we do hook you up to the appropriate equipment to monitor your heart rate and your oxygen, and to gradually increase the intensity to give you some more tangible data regarding your performance. But otherwise, I completely agree with Kim's answer.
Great, thank you. Derek, I believe this next question could be for you as well. It is, I want to do a home-based program. Where can I start?
That's a great broad question. The best place to start is actually an in-person assessment. So you should develop a rapport and a initial baseline of kind of functional performance, aerobically and physically. And then the therapist, either an exercise physiologist or a physical therapist or a respiratory therapist, will be able to better prescribe a rehab program for you. So then there's once that's established, kind of exercise, specific exercises and exercise guidelines and parameters, then it's a kind of a collaborative self-management where you do a check-in every week, every 2 weeks, whatever fits your lifestyle, with your rehab professional that you're working with. But it rarely starts, in my experience. It goes poorly if the first session is done via video. There is a great value in the in-person assessment.
Good point, thank you. And then one more question for you. Where and how can I get the AidCube app, or is it only for Pen Med patients?
Yeah, the AidCube app was developed for pre and post-transplant patients at UCSF in San Francisco and at UPenn who are undergoing kind of a telemedicine exercise study. So that's a kind of a private app, but a lot are coming on the market now that's are similar to AidCube. Why AidCube was specific is it was hooked into our study database. So all of the information that the patients and myself put into the app was collected into a REDCap database and then used to analyze and, you know, draw conclusions and papers from that.
Sure, thank you for clarifying. And then a question for Mal, our support group leader on the panel. The question is, what have been some of your best or most popular topics at support group meetings? And then you're on mute, so you may want to take a moment to unmute.
Thank you, Laura. Well, we have a number of people that come to our support group meetings. So I don't know, it's really kind of difficult to say. I think that we have our biggest topic has been, I think, oxygen. It's one of the biggest topics that we have. That is the use of oxygen, the availability of it, tubing, things of that nature. And the next thing that is most important for our meetings, the most important topic that most people want to know about, are lung transplants.
Sure. And then a follow-up question about your support group. What is the size of your group, and would you say that participation varies throughout the year?
A typical size for our group is anywhere from, I'm going to say, 12 to 15 people. However, in the month of August, when I thought there would be nobody on our Zoom link, we wound up having 20 people, which absolutely floored me. It's really difficult to say because you have to remember that people in your support group, many of them are not well, and the times that you have may conflict with doctor appointments or other activities that they may be involved with. But if you can get even 10 people, now people have told me that they average between 9 and 12. So if you get anywhere between 10 and 15 people, I think you're doing well. And if you're starting out, don't get discouraged. You might find 5 or 6 people, but over time, you will get between probably 10 to 15 people. That's probably an average.
Great, thank you. Another question, I believe this could be for Kim and or Derek, if you'd like to chime in. Lots of questions are coming in about finding therapists for home-based programs, where to start with that. Is there a specific resource to look at, or where can somebody find this information?
I'll launch us, Derek, and then
Sure.
if you want to fill in what I missed and put in your expertise, that would be great. So sometimes, you know, we want to look at what does insurance dictate, because some therapists can come to the home and be covered by insurance. So I would first look at that. And again, you know, is it for physical therapy? Is it for cardio conditioning? Is it overall? So I would definitely look at insurance first. And then I would use, of course, resources through the Pulmonary Fibrosis Foundation, National Institute on Aging, and then the Pulmonary Fibrosis Foundation also has a nice toolkit that they've put together with the American Association of Cardiovascular and Pulmonary Rehabilitation. So those would be sites that would give you definitely therapists that have that knowledge base to come to your home to work with an individual with a chronic condition. So you definitely want a therapist with that background. Derek, what do you think?
Yeah, that is a challenging question. In my first impression was the AACV PR website, which you just said. That's the accrediting body of kind of cardiac and pulmonary rehabs. And you can even call your local center and see if they have a therapist that's willing to do kind of a home visit or an initial assessment, and then follow you for home recommendations. It's challenging to get insurance to pay for this right now. A lot of the therapists that I know in the Philadelphia area are private pay, because the advanced lung disease is a very niche patient population. It's not your garden variety physical therapy, home physical therapy for an orthopedic injury. There's a lot more medical training that goes into it. So there's going to be few and far healthcare professionals in between that are willing to come to your house and follow you, because you also have to establish kind of a physician relationship as well. So there's a lot of different layers to that question, ranging from insurance to private pay to getting the right healthcare professional at the right time. I wish it was easy as a menu of therapists that would, you can click and choose. Very new development in regards to physical therapy. There is a wave of companies and that are coming for home visits. We can download apps. I can send the information to Laura, and they will do a concierge or home physical therapy visit. That been a lot of money and time invested and kind of hyper accelerated over the last year. Unfortunately, usually in larger cities, not in the rural areas. But there's kind of 3 or 4 companies that personally contacted me to be a part of their kind of their network. So those are really rolling out fast.
Okay, great to know. Thank you. And any resources that are shared, we'll make sure to make available either on the Summit platform or our social media sites or our website, so that all attendees can have the access to that information and be able to utilize it on their own. So thank you so much. It's hard to believe we're already winding down for this Q&A session. I think that's just about all the time that we have for today. I do want to thank all of our faculty presenters here today for a really informative session and great discussion afterwards. And also thank everyone in attendance today for joining us. An item of note is that we will be presenting the second day of our clinical trial innovation series in Theater 2 in an hour. So please join us there to hear updates from United Therapeutics Corporation, Pliant Therapeutics Incorporated, and Chiesi Pharmaceutics. So we're looking forward to that taking place. Feel free to take a break and join us back there in an hour. Thanks so much.